Okay, this short video is intended to help with the heart dissection in anatomy lab. Since it's a rather short lab, I thought I would prepare this video so you can take a look at it ahead of time. So, this should look familiar. It's just a quick sketch of the heart. Assume anatomical position. So, left ventricle, right ventricle, thinner ventricular wall. There is the interventricular septum, which is thick, forming the other wall of the left ventricle. Left atrium, right atrium, and you should be able to identify the different blood vessels, if not now, by the time you study this. So what I wanted to point out is if you have this sort of illustration in your mind's eye, and you know the route of blood, and you can trace it through the heart, the vessels and the valves, then it makes a little more sense when you look at the heart dissection. So just to kind of run through this, this would be the right atrium. So this would be the inferior vena cava and the superior vena cava, which I'm abbreviating IVC and SVC. And the blood returns from the systemic circulation through the vena cava into the right atrium. From the right atrium, it flows into the right ventricle through the right atrioventricular valve or the tricuspid valve. So I'll just write tricuspid since it's shorter. Tricuspid valve. That's the first valve blood flows through. Flows into the right ventricle. The right ventricle swells, expands with new blood. When the heart contracts, when the ventricles contract, the blood is forced out of the right ventricle into the pulmonary trunk, which I'll abbreviate as pull trunk. This is arterial blood. It's leaving the heart. And these would be the left and right pulmonary arteries, which I'll abbreviate pulmonary AA for arteries, right and left. That goes out to the lungs, both sides, left lung, right lung, gets oxygenated, drops off the CO2, and returns from the lungs to the left side. So these are the pulmonary veins that are carrying freshly oxygenated blood from the lungs. So those are the pulmonary veins, VV, abbreviation for plural of veins. And on the models, these would be colored red for the oxygen, but they are the veins, and these are colored blue, but they are the arteries. So don't think that arteries are always red, because in the pulmonary circuit, pulmonary arteries are shown to be blue because they're low oxygen. But again, they're still arteries because the blood is leaving the heart. As we left the heart, the second valve that the blood passed through, leaving the left ventricle here, this little flap valve we'll see on the heart dissection, and this goes by a couple of names. You can call it the pulmonary valve, or the pulmonic valve, or the pulmonary semilunar valve. It's all the same thing. So that's the pulmonary valve leaving the right ventricle. Comes back, as I mentioned, from the lungs to the left atrium. Atria is plural for atrium. I should have said left atrium. Flows from the left atrium into the left ventricle. And you can identify the left ventricle because of the wall thickness. The valve that it passed through between the left atrium and the left ventricle goes by several names. So it could be named the left atrioventricular valve, could go by the name of the mitral valve or the bicuspid valve. You should know all those names. You can use either one to describe it. But that's the flap valve that we'll see in the heart dissection. So blood is now into the last chamber of the heart in its circuit. When the ventricles contract, blood flows into the aorta. Aorta, through the aortic valve or the aortic semilunar valve. So draw an arrow up to that valve. That is the aortic valve or the aortic semilunar valve, the last valve. Notice in this drawing I put in the three flaps, two shown, of the aortic valve, and directly behind those flaps are two openings. This is the first blood that comes off of the aorta, and these are the left and right coronary arteries. So if we're lucky, when we find the left ventricle on the heart dissection, find the valves, and right behind them should be two little holes, and those are the openings to the left and right coronary arteries. So I'm cramped for space, so I'll just abbreviate it, coronary art. That. Okay? So that's the drawing. You should be able to sketch something out a little bit quicker than I spent drawing this out. Make it a stick drawing if you have to, but make sure that you can trace the drop of blood through the 4 chambers and the 4 valves in order, and the major vessels to and from the lungs and to and from the heart. Okay. So here are a couple of pictures out of Netter, and this illustration just shows a section through the heart as if you took a knife and sliced it as shown in the plane. Left ventricle, right ventricle, and they left it attached on the left ventricle and just folded the 2 halves apart, which would be over on this edge. So at any rate, there again is the interventricular septum, thick, for forming the wall of the left ventricle on both sides. That makes that the left atrium. That makes this valve between the left atrium and the left ventricle, which is the bicuspid mitral or left atrioventricular valve. Papillary muscles, the chordae tendineae, and this is the aorta. So blood is leaving the left ventricle, flowing up through the aortic semilunar valve into the aorta. The other side of the aorta is shown on this side, and if it shows up in the video, here again are flaps of the aortic semilunar valve, and directly behind the flaps there are the openings to the coronary arteries. That's interesting to find. Hopefully you can see that. The right side of the heart, here it would be the tricuspid valve, right ventricle, and the right atrium is not shown well. A different view, and this is what I hope to show on the video. Here's the heart, and this is what I'm going to do, is we will start with the right ventricle, and we're going to find the pulmonary trunk. That's the landmark. It's easy to find, and we will cut down through the pulmonary trunk, and we'll go right along the septum between the right and left ventricle. We'll cut this. It's fairly thin, and then we will reflect this wall like a window and look in and see the right ventricle and the valve. So that's the plan. Here is the heart. Give me just a second to put gloves on, so if you want to pause the video for just a second or let it run. These are sheep hearts, and they have been preserved. You have to massage them a little bit to soften them up as best you can. To get oriented, the apex of the heart is the left ventricle. So you're looking at an anterior view of the heart here, and the interventricular septum runs right along this fat line. And there's a sulcus in there between the right ventricle and the left ventricle, and the large coronary artery and cardiac vein are in there. So it's a landmark. This is left ventricle, forming the apex of the heart, and this is the right ventricle. And another landmark to find, since this is right ventricle, it's fairly thin, up near the top is the pulmonary trunk. So this vessel is coming out basically from the right side is the pulmonary trunk. And if I can stick a probe down in it, it's sort of a landmark to help you get oriented. The aorta is coming right out of the center of the heart, and in these hearts it's cut fairly short. But this will get us started. So if you identify the pulmonary trunk, then what we're going to do is take the scissors and cut right along that, come through here, get close to the septum, and I'm just going to cut down quite a ways, and oops, and then I'll cut back up, and we should be able to reflect this as a window. So you're going to cut right through the pulmonary semilunar valve, and I want to get the scissors over against the septum as much as possible. So there's the wall thickness of the right ventricle. It's about 1/3 the thickness of the left ventricle. And then I'm going to cut through part of the right atrium. There are these little modulator bands of muscle in between. This is not the chordae tendineae, it's just a band of muscle. Cut that. And then I'm going to go up the other side. And that's pretty good. I'm going to cut off some of this pulmonary trunk just to give a better window for seeing what's happening inside. So trimming off part of the pulmonary trunk. Okay, let's see what we have. So this is left ventricle, and looking inside there is the tricuspid valve, and these are the chordae tendineae, and the flaps of the valve is very delicate, and so these come up. I hope you can see this in the film. These are the flaps of the tricuspid, and again these are the little strings, the chordae tendineae, and they go out and attach to papillary muscles on the wall. So if I take the probe and go straight up through the tricuspid valve, you know that I would be entering into the right atrium. So I'm going to stick my finger through there. I'll go back to the probe. And that's going to put us up into the right atrium, and if you wiggle around you should be able to exit that through the vessels. that enter the right ventricle, the right atrium. So there's the probe. I put it through the other side. So it's coming through the tricuspid valve. So I inserted it through the vena cava, which went into the right atrium and passed through the tricuspid valve into the right ventricle. So blood leaving the right ventricle goes out to the pulmonary trunk. And what I'd like to point out are the flaps of the pulmonary valve. They're a little bit hard to see. I need an assistant to hold this thing. Let me chop some more of this off of here. Okay, so this works. If you can see, again, the right ventricle, and the blood leaves the ventricle and goes out into our pulmonary artery. And there needs to be a valve there, the pulmonic valve, and they're just they're very thin flaps. So here's one of them. And the blood that's in the pulmonary trunk, when the heart relaxes, the blood wants to flow backwards, hits the pulmonary valve, and is trapped from going back into the right ventricle. So there's one flap on that area. There's another one on the other side. They form a ring going around the entrance to the pulmonary trunk. So those are the pulmonic valves, and that's basically the right side of the heart. So we did the right side. To do the left side, it's a little bit trickier because the aorta is coming right out of the middle of the heart. Most of the heart is left ventricle. So there's the aorta, and what I'm going to attempt to do is to cut straight down through the aorta like I did with the pulmonary trunk and open up the left ventricle. There's my septum. So I'm going to, once I get through the aorta, I'm going to come over here on this side and try to do a similar cut that I did on the other side and reflect the left ventricle. It's a difficult one to do because the wall thickness is so thick. So let's see how this goes. If I don't like it, I can get another heart and try it again. It taxes the limits of these scissors. Okay, not bad. That opens up the left ventricle. And I came down to the aorta. And what I'm going to do is try to cut off some of this mess at the top. It's getting in the way, and we don't have to put this back together at the end of the lab. There, that's not bad. So there is the left ventricle, and there are the chordae tendineae. So there's two valves here. This was the aorta that I cut, and there are the flaps of the aortic semilunar valve. Those. And behind those, if we're lucky, we would be able to see the openings to the coronary arteries. I have another heart that's a little bit easier to work with that I'll show those in a moment. So at any rate, that's the exit out of the left ventricle. There is the tricuspid valve, and to put the probe gently through that, it's going to go back up into the right atrium. So my finger, you can see that I'm pulling the probe out through the bicuspid valve, and my finger is going down through the the left atrium, and it's coming out through the it's coming out through the bicuspid valve, the left atrioventricular. So notice that the wall thickness is much greater on the left side, that thickness, than it is on the right side. So if you're seeing a heart and it's opened up like this, you can just look at the wall thickness and realize, oh, right side, low pressure, thinner wall. That means this has to be the left side. And if this is the left side, that means that this valve is the bicuspid, means that this is the aorta, and that would be the aortic semilunar valve. So once you get oriented, you can kind of go through by process of elimination to identify the proper chamber, valve, and vessel. So that worked out fairly well. This other heart is one that I made a slice through with a large knife in one pass. And again, here is the right ventricle on this side, and left ventricle is over on this side. And that makes this the bicuspid valve. So this then has to be the left atrium and left ventricle. And I want to see if this is the half. I'm going to get the other half of that here, because these two halves came apart like this. So I sliced it right down through the center, and I opened it up, sort of hinging on the left ventricle. So if I take this half, here's the left ventricle again, thick wall, and this valve between the left ventricle and the aorta is the aortic semilunar valve, right here. And I'm going to trim away a little bit of the wall of the aorta. Because it shows the openings to the coronary arteries. So, you can kind of get oriented again. Here is the left ventricle, the aorta, and here are the flaps of the aortic semilunar valve. There's one. And there is the other. And I'll open this up, and hopefully you can see a dark spot right where the tip of the probe is. So there is the semilunar valve, and that hole right behind the semilunar valve is the opening to the coronary artery. And interestingly, when the ventricle is in diastole and blood, in systole, and blood is leaving the left ventricle, the valve has to open to let blood flow out, and as it opens, it covers up the coronary artery so that blood doesn't get forced into the artery during systole. When the heart relaxes, when the muscle relaxes, blood flows back and closes the aortic semilunar valve to prevent blood from refilling the ventricle. At that point, the blood flowing back can enter the coronary arteries and supply the heart tissue. So, that's about it. enjoy your dissection.